People from Black and minority ethnic communities are still experiencing some of the harsher aspects of care and treatment.
We know that people from BME background are more likely to be admitted to hospital, more likely to be detained under a section of the Mental Health Act, often have poorer outcomes.
Higher use of medication, higher use of community treatment orders.
There is, within the policy sector largely, as you go around the country, a feeling that now that we have done the Delivering Race Equality program, that all our issues have gone away. It's like we've invested 5 years in this, we've done all this work, why are you keeping on talking about this? But we're not seeing that change in terms of actual people's lives.
There needs to be more of a kind of concerted, sustainable effort to create services that people want to use.
We'll be starting shortly in the next 5-10 minutes. Wait for a few more people to come along.
Hello.
Canerows services, it's user-led services. Not exclusively BME, but it's BME.
Canerows consists of ward visiting in the community, have your say, consultation, sharing information.
Care support is something that is picking up now with certain services within London. It's about supporting each other, helping each other, because we understand each other.
As you know, leaving hospital can be really daunting. We work with people for up to 6 weeks just to settle them in. So it could be anything from playing tennis, believe it or not, or shopping, or just having a cup of tea and coffee. What else they might do is take clients to a drop-in. Now, Mama Knows is the drop-in that I run. It's based at Catherine Lowe Centre, which is a community building, so it's used by a lot of the community. It's a really wonderful place. We're a team, really. We've become very close, seeing the same people every week. You know, you get used to people. You wonder where they are when they don't come, if they're all right, if they're healthy, you know, or if they're feeling a bit miserable. Or we really check out for each other.
The community does not care for people with mental problems because they know nothing about mental health. How can they care for us? The caring comes from people who have the mental problem. So we care for each other, support each other.
I've been in hospital many times myself. I've stayed out for 11 years now. I've spent 2 years at one stage. I was in and out for 9 years as well.
I've been doing ward visiting for a little over 4 years now. So I'm quite an experienced ward visitor. Hello, Minnie. How you been? What to talk about is something that I would imagine is up to you because you can talk about anything you want to talk about. But I usually use my life story as a talking point to the patients.
If you can do it, then I can do it too. And that's the message I want to get across. I have been ill. I've been really ill, probably iller than you are now. And I've still rose above it and been able to do something positive with it.
I got diagnosed with first episode psychosis. It was quite a scary time, I have to say. I just remember being absolutely afraid and feeling desperately alone. Even though there were people around me, I became a recluse, lost in my own little world and not able to express the way I feel. Having someone who's been on the ward come in and talk to you and sit with you and have a good conversation, maybe a cup of tea and some biscuits, you know, that really helps. For me, they were kind of a beacon, a kind of light that shows, you know, what I could be. Sometimes where you're just absolutely hopeless and you can't find a way out, for someone to say, do you know what, I've been in your position and look at me now, you can get through this. You know, you just have to take it one day at a time, really.
We have supervision meetings once every 2 weeks, and we talk about how the visits have been going, what people have said, if there's any issues. It's like a sort of place where you can let down your mind about, what the visit was actually like with the other visitors. You do encounter patients who are quite, up in your face and sort of, highly elated.
Come here, Devon, he said. I said, oh, you remember my name?
To tell the honest truth, if I can make a difference for just one person, it's worth doing the whole ward visit for anybody.
Canerows helps to improve the understanding of professionals. I think it helps to promote trust amongst service users who feel able to confide in, speak with somebody who they feel has gone there before. It validates demonstrably the work of service users themselves, of their role as experts by experience.
I was part of a work that Mind, the national mental health charity Mind, did looking at crisis care. And if there's one thing that came out of that study was people saying that what is lacking in our mental health services is empathy and human kindness. What Canerows is doing is just taking that back into the ward. It is about what have I learned about myself and how can I help the other person? So you're not going there as a giver, and that person is not there as a receiver. This is a mutual and reciprocal process. And I think Canerows' work really puts that into focus.
The recovery approach doesn't seem to resonate fully with some BME people. It's very much based on thinking of the individual in isolation from others around them, doing the journey themselves, but recovery in association with family and community. And if necessarily, accepting dependence on other people is much more important for BME communities.
I think we can get better. I'm always wanting things to get better. But I do think that there's some really good services. And Canerows particularly is something that I think is a good example of it, which is something that people have looked at and, it's not, the NHS have decided this can help. This is something that local people have looked at, identified a problem and looked at a way of doing things. And we're working with them to be able to try and improve services.
Peer support is about communities. How do we support communities to do that? And not just in terms of you've had a mental health experience, you've used services, now we will give you peer support.
I think there is a danger in institutionalizing. It will be yet another form of treatment. And that's you lose by that, I think.
Devon, Coral, Canerows, Paul, you name it, James, Amy, Roger, we're all one big family, just put it that way.
I think what the vision I have for Canerows is that what it is, it's about supporting each other and helping each other. And that can never die. The key to all is break down barriers, build bridges, and create a community of people in the community.